Hey there, my name is Naomi Salas, and today I will be talking about antisocial personality disorder. I think the easiest way to explain this disorder would be to know that people with an antisocial personality disorder have no regard for right or wrong. When we're young, we are told, don't do this, don't do that, and we learn that we shouldn't cheat, we shouldn't steal, we shouldn't lie, and take things that aren't ours. But people with this disorder, they have no regret or remorse for doing these things. They know that they're right or wrong, but they just don't care if they hurt people, manipulate, exploit, or abuse others, and they don't feel any guilt about what they're doing as well. People with this disorder are on the rare side, with only 3.6% of the population having it. This disorder is much more common among males, with a 3-to-1 ratio of men to women. It is more likely to occur in men who are younger, widowed, separated, divorced, or have a lower social economic status, and also people who live in urban areas and the western United States. This disorder has a lot to do with genes, and it has a lot to do with your history as well. It would be like a 50-50 split. People who have this disorder have a very high rate of an abusive past or a violent past, and this will affect them in the long run. People with antisocial personality disorder seem to view the world as a self serving and unkind world. They seem to think that they should use whatever they need to get by in life. They tend to view people as not living, thinking, feeling things, but rather as pawns that they could use and abuse for any purpose that they need. They often use an overinflated sense of themselves and appear extremely arrogant. Basically speaking, people with disorder lack empathy. They're incapable of understanding the emotional point of view of others. Diagnosis. A diagnosis for antisocial personality disorder is a tricky one. There is a lot of prerequisites that come with a disorder like this. There is an acronym called ACID liar, and this is an acronym that they use to search for personality traits that will align with this personality disorder. And if you have two or three of them, then they will consider you for having it. Um, First thing is that it comes with a lot of identity confusion. So this is going to be not really understanding who you are or consistently changing who you are and feeling like you don't belong. It is importantly a diagnosis that you will receive when you're 18 years or older. Now, this is mainly because when you're younger, your personality is changing quite a bit, and they want to wait till you're adult for things to settle a little bit more so that they can look at all these different categories and then try to figure out which ones you fall under. People with this disorder, they have a high rate of crime, and unfortunately, a lot of people who have this disorder are in prison. They do a lot of things like stealing to get what they want, and it causes a lot of crime. They're very impulsive. They do things with a disregard for safety, as in speeding with kids in the car or doing something while they're watching kids and not caring that they're there. They will lie for no reason. They're very irresponsible in the sense that they will take weeks off work or they will just quit outright without looking for another job just because they don't care. They are very aggressive, and that's physically and also verbally aggressive. But most importantly is it's a targeted aggression. So they're going to find someone that they have a problem with or that they can get something from, and they will target that to get what they want because they're very remorseless. And they have a disregard for other people's emotions, which I talked about before. This disorder is a lifelong condition. The symptoms are the most severe around 20 years old and sometimes improve by the age of 40. People with this disorder, in the minor case, ignore right and wrong. They lie to take advantage of others. They're not sensitive or respectful of others. They use charm a lot to manipulate others for their own personal gain or pleasure just because they like it. They have a sense of superiority and are extremely opinionated. They have problems with the law, like we discussed before. They're hostile, aggressive, violent, and threatening to others. They feel no guilt about harming others. They do dangerous things with no regard for the safety or of themselves or others. And they're irresponsible and failing to fulfill work or financial responsibilities. Now, in a more extreme case, they are involved in illegal enterprises. They show cruelty towards others. They leave their job with no plans to obtain another job, have multiple sexual partners, and they'll even go on to not tell other partners about STDs and things like that just because they have no regard for others' safety or well being. They repeatedly get into fights with others and they show a reckless disregard for others and themselves. People with this disorder have a very harsh view of the world, and it is very common that there are some misconceptions about this disorder. One of them being that it's not treatable. The managing this condition is possible, but it is a lifelong process, which a lot of people struggle with, which can cause the misconception that it's untreatable. And also, a lot of people think that it's just an excuse for poor behavior. Like you have antisocial personality disorder and you're gonna just behave wrong. But people know that they're doing something right and wrong. It's just that they disregard any of the emotions attached to it and they just don't care that they're doing something right or wrong. Um, and a lot of people think that people with APD are psychopaths, but they are not. They are actually what you would more consider a sociopath. Some types of therapies that can be used would be group therapy, using people who have the same disorder as you as a guide to help manage and maintain a healthy lifestyle with it. Family therapy, where you can teach your family and friends kind of the ins and outs of this disorder and help as well maintain and have a healthy relationship with your disorder. And a really popular one being cognitive behavioral therapy, which works on changing your thinking and behaviors. Some medications that can be used are antidepressants, will help the serotonin levels, antipsychotics, which help regulate your violent behavior, and mood stabilizers, which help manage severe changes in your mood. Now, this therapy is effective and it is very hard. While participating in your treatment, your outlook may be positive, but you'll have to continue through your entire life. Understandably, this treatment is not easy and it takes a lot of energy and effort to make these personal changes. Stopping treatment can cause your symptoms to worsen, which puts you at risk of harming yourself and others. And I think it is important to say that a lot of these disorders have a high risk of self harm, and therapy is very important. Thank you.